Frequency Podcast Network. Stories that matter, podcasts that resonate.
In less than 6 months, more than 300,000 FIFA fans will descend upon two of Canada's largest cities to watch the best in the world go head-to-head. And while those 13 matches will bring this vibrant energy and excitement to Toronto and Vancouver, along with them will be a handful of threats to a barely held-together healthcare system plagued with understaffing issues and lack of resources. And beyond the spike in emergency room visits for overconsumption of alcohol or reckless behavior, where does our system stand against the battles that go beyond the emergency visit, such as an infectious disease outbreak or a brazen violent attack on a crowd? Is our healthcare system equipped for surge capacity at this extent? And how can the federal government step in to take measures at the national level to ensure large-scale events that support the economy and uplift the community aren't the breaking point for an already fragile healthcare system? I'm Maria Kestane, and today on The Big Story, I'm talking to Dr. Catherine Varner, emergency physician and deputy editor of the Canadian Medical Association Journal, to break down the vulnerabilities at stake ahead of the World Cup and how Canada can use its own history in large-scale event management to shape the future of health and safety to come. Dr. Varner, thank you so much for joining me today.
Yeah, thanks, Maria. Thanks for having me.
You know, the strain on the healthcare system during the World Cup, unfortunately, does fall to the wayside of the excitement and overall hype of the event. You know, not many people think of, how are our hospitals going to handle all these matches, when their favorite teams are playing in their hometown. What are the specific healthcare risks that we could be seeing throughout and after the World Cup?
Yeah, so, there's a large body of scientific literature about mass gathering events and their impacts on the healthcare system. So we have a pretty good sense of what we can expect. We know that mass gathering events, particularly related to sports, there's often an uptick in emergency department utilization for alcohol and substance-related visits. There also are increases in trauma that come to the emergency department. Those are more specific to sporting events, but for a longer event like the World Cup, where we're having over 350,000 visitors to both Vancouver and Toronto, the effects can be more prolonged. So you can also have infectious diseases type outbreaks, like we saw after the Vancouver Olympics. There was a measles outbreak that affected the city and its areas around it for about 3 to 4 months after. And then there can also be in these large gathering events things that can be related to the weather, like heat-related events that can increase emergency department utilization.
We are less than 6 months out from Canada's first match. How is the federal government and both BC and Ontario preparing for what's to come?
I think the cities have taken on the largest bulk of the planning for these events. And, they are no strangers to hosting mass gathering events every summer in our city. And then these sort of unique events like the Vancouver Olympics or the G20. I mean, these are huge events that invite a lot of people. And so the cities take on events and planning around the World Cup. They also take on planning around mass casualty and preparing for, God forbid, an event like that. So I think we're fortunate in both Toronto and Vancouver to have really world experts that plan for these types of events and anticipate them many months, if not a year, before the events start. Now, the reason why I wrote the editorial is because those plans, albeit made by experts, have to be executed by the healthcare community and the hospitals that are in these areas. And having worked in an emergency department during the World Series, I know that we just don't have a lot of surge capacity. And that wasn't in the middle of influenza season. It was in October. And there was really no surge capacity to move patients in the event of a large surge or an external disaster needing patients to be seen quickly in the emergency department setting. So it's something that weighed heavily on my mind at the time during the World Series. but also I think looking forward to the World Cup, where we have people in the city for a month-long period of time and potentially needing emergency department resources.
Yeah, I mean, you are an emergency physician, and what were you seeing in Toronto when it was the World Series? What kind of patients and situations were coming through the hospital doors?
So very predictably, as what's shown in the scientific literature about these types of events, and having worked 15 years in an emergency department downtown on when events are happening in the city, particularly related to sports, we see people coming in with alcohol-related, substance-related, and sort of trauma-related events, and they don't happen in the stadiums often. They don't happen in the event spaces themselves. It's often around the city, in the bars and in the streets where people are celebrating. That's more often where we see the foot traffic coming in to the emergency department. In preparing for those World Series shifts, I remember going in early and reviewing our external disaster type scenarios, so worst case scenarios, and thinking about step 2 of those external disaster scenarios, where you have to what's called decant your emergency department to make space, and really recognizing that I'm not sure that we would have the space to do that, because decanting means moving patients from the emergency department to other parts of the hospital. And when all of the hospital beds are full, where are you going to move patients? It's not easy to move patients who are admitted in the emergency department space and are on oxygen or elderly. We have difficulty moving them. If you don't have the physical space, it would be hard to imagine a scenario where we could quickly decant and open up space in our emergency departments.
You did mention that Toronto and Vancouver are kind of, carrying the heavyweight in terms of preparing. Is Ottawa, in these situations, what kind of help do they give?
As far as I know, I'm not aware of a national response to preparing for the World Cup for these types of events. But I know that in thinking about whether it's influenza season or a climate emergency or a global defense escalation, many of the conclusions sort of come back to the same point, in that we're vulnerable and lacking hospital capacity.
I want to talk about our vulnerability in terms of measles. We know Canada lost its elimination status late last year. And we also know that, going back 16 years after the 2010 Vancouver Olympics, there was an outbreak. Can we expect a similar pattern more than 15 years later with how our current measles situation looks like?
Yeah, so we had our measles elimination status at the time of the Vancouver Olympics, and it was not nearly as prevalent as it is now. And so, I think we can all imagine a scenario where measles becomes part of the World Cup because of the current prevalence in our North American society in particular and how infectious measles is.
For years now, there has been this fundamental shortage of resources across our healthcare system, specifically with staffing. And, essentially more staffing is what's needed here during the World Cup to literally just keep the lights on. Never mind have an efficient healthcare system working, but just to, get us to the end. Can you paint us a bit of a picture of where we're at right now? What's our current situation looking like, and how much is needed to get us through?
So I think it's interesting we're having a discussion right now because on Friday there was an announcement made by the Ontario Hospitals Association, sort of predicting and the tremendous deficit that many of the Ontario hospitals are facing right now and in the years to come, and anticipating over the next few years cuts to hospital staff, cuts to hospital beds, and therefore cuts to patient care. I really can't imagine a worse time to cut hospital capacity, given they're already running at such a lean scenario. And so, whether it's the World Cup or a climate disaster or flu season, I just don't think we're in a situation where we can afford to cut hospital beds without really, continuing to impact the quality of care that patients receive.
Right. So in terms of numbers, how many more doctors or staffing or nurses is needed in terms of getting us through? Like here in Ontario, how much would you say?
So there's the personnel on the ground that could be asked to increase in those shifts in and around the immediate area, the hospitals sort of that are closest, and they are making plans to increase personnel, I believe, during those times. But the bigger challenge is that surge capacity. So how can we keep some of those, so like critical care beds that would be needed if there was an external disaster type event, available in the areas of the Vancouver and Toronto vicinity. So we did some of that as a healthcare response during the pandemic, where there was like an incredible effort to ensure that ICU beds, for instance, were maximized in terms of capacity. So making sure that if patients needed ICU care, they were able to receive it, and really anticipating what was needed around the province to maximize that sort of critical care resource. And we've never gone back to status quo after that. However, there have been less resources pushed into that sort of resource planning allocation space after the pandemic. And so flu season, for instance, we walk into almost every year with our fingers crossed and hope for the best, and we see the worst, right? We see bad things happen in waiting rooms. And so my hope is that we really use some of those lessons learned in surge capacity in the pandemic and apply them, early, before the World Cup events or in flu season, such that we can prepare for and accommodate these types of surges.
You said you cross your fingers and you see the worst. What is the worst?
The worst in emergency medicine is knowing that too many patients are in the waiting room who need care in a hospital bed. So they've been triaged or waiting to be seen, and there's not a physical care space available to them because all of or most of the hospital beds in the emergency department are filled with patients who have been admitted to hospital. And so, in my mind, as an emergency physician, is worrying about the patient whom I have not seen yet that is sick in the waiting room and actually belongs in a hospital bed. And we see that every flu season, where we hear of these tragic outcomes in a waiting room because somebody's waiting many hours to be seen when they, should have, could have, in a healthcare system that had more capacity, been able to be seen more quickly.
Would it be greedy if British Columbia or Ontario, I guess, borrowed doctors or nurses from other provinces? Like if Ottawa, or I guess Ontario or BC doesn't necessarily invest in hiring more staff, could there be some sort of interprovincial collaboration opportunities that don't ultimately, come at the cost of healthcare systems in those provinces?
So there was certainly that type of enthusiasm around the Vancouver Olympics. People traveled across the country to work and support the healthcare system in various capacities in the Olympic Village. And I don't think there's quite that much infrastructure around the World Cup to date. And all of the provinces right now are struggling with their hospital capacity. Even in our, I would say May, June are often some of our lighter months with respect to emergency department volumes. And yet, I'm not sure that any of our hospitals are going below 100% capacity at any given time during the year. So, we're functioning at 100% capacity in the off season, so to speak. And in our flu season, we're at 130% capacity. So where would we get those healthcare workers? I'm not sure.
Besides health-related infrastructure risks, we're also presented with these very scary opportunities of, domestic terror attacks or mass event crime. How much of a risk do these threats contribute to the overall picture?
I can't speak to the actual risk. I mean, I think those are all of our worst nightmares, both as people living in these cities and wanting to attend these types of events. All I can say, if that type of horrific scenario were to happen, I would hope I was working in an environment where I could best support the patients coming into my care. And we have world-class health professionals, both in paramedicine, as well as in our hospitals. And, we just need more of them. Like we provide world-class care in our hospitals. I'm sure of that. And so the more capacity that we have to provide that best care in a resourced way, I think the better and more comfortable we would all be going forward.
Can the RCMP do anything proactively to help kind of maybe get ahead of potential threats? Can they be of help here?
That's beyond my expertise to answer that type of question.
But would you want to see some sort of, inter department, I guess, collaboration between, healthcare and crime prevention? Like, can local police or provincial police or the RCMP be of help in terms of supporting hospitals and emergency rooms?
I think the best example of collaboration of your question is, prior to the World Cup, but also on an annual basis in the city of Toronto, they run these sort of mass casualty simulation events where it's professionals from across the disciplines work together to by the hundreds to simulate what this would look like. And so in March, there's a simulation event at Centennial College that does exactly that, where people work together from multiple disciplines across many domains to really simulate what that type of response would look like in the city of Toronto. And that's been going on for years. So we do have, like I said, world-class experts that are thinking about this, creating plans, making sure that we have sort of best laid plans for worst case scenarios, so to speak.
In the article that you wrote about these vulnerabilities, you also point to the relationship between defense investment and healthcare shortfalls. Why can't we invest in one and not the other?
I think that's what the article calls for, is thinking about healthcare system capacity as a vulnerability of Canadian sovereignty. And that's something that came out in a collaboration between some healthcare leaders and Canadian defense, as well as provincial and federal health officials, in a simulation that was described in the Toronto Star last year, where that was really one of the key outcomes of that simulation, was that they recognized the vulnerability of Canada being involved into an escalation, like in Europe, for instance, where we would have a hard time repatriating soldiers to our healthcare system or providing meaningful numbers of healthcare personnel overseas. And so it really opened my eyes to realizing that many of us are coming to the same conclusion, whether we're working on the front lines in an emergency department or in downtown Toronto, or if we're thinking about a global defense escalation, or if we're thinking about responding to a climate emergency or a forest fire, we're often sort of faced with the same challenge.
We're also in this very nuanced geopolitical time where Prime Minister Mark Carney has seriously floated the idea of sending Canadian troops to Greenland to show support amid annexation threats. If that does manifest, how drastic does that change the picture just a few months ahead of the World Cup?
I don't think any of us have ever imagined or contemplated being in this scenario, to be honest, as a person living in Canada. I don't think any of us want to imagine an escalation in that way, and it sort of seems out of this world to think about. I would want us to be able, in our healthcare system, be able to provide the best support for our troops abroad, and to be able to repatriate them if they had any injuries or healthcare needs to our healthcare system, to provide them the best care possible. And I think that's what most people living in Canada would want as well. And I can only speak from my perspective as a frontline provider and someone living in Canada, that I would want to be able to support those who are supporting us in that way.
Right. But to that point, I guess, if we did have to send troops out and we did have to, send, medical professionals with them to Greenland, I mean, what will happen back here at home? Obviously the troops in Greenland need that support. They need medical professionals. But then back here we still have this crippling healthcare system. Like where can we go up from here? Like is this rock bottom that we're at?
I think that's a great question for the federal government to contemplate.
Right.
And there are people both in healthcare and in government who I think are thinking of that right now, and realizing that it is a vulnerability to our defense response.
In your article, you call for a national plan to help, ahead of events like this. What do you want that national plan to include if you were advising the Canadian government? What would you say are some top priorities?
Compared to peer nations, Canada has some of the lowest hospital capacity per capita. And so the national response should be to have some measures that ensure that provincial funding to the healthcare systems ensures that hospital capacity is prioritized. And so while the federal government provides the funding, the provincial governments allocate the funding. And so there need to be conversations about how and what to prioritize. And so I leave that to the government officials to discuss, but prioritizing physical beds in hospitals to care for patients, I think we are deluding ourselves to think that we can continue with such lean acute care capacity in our healthcare system.
All right. A very important conversation. Hopefully, in a few months' time, things look a lot different. Dr. Varner, thank you so much for joining me today.
Thanks so much for having me, Maria. I really appreciate it.
And that was the big story. As I said, this conversation is an important one. Send us your thoughts at hello@thebigstorypodcast.ca or leave us a voicemail at 416-935-5935. If you have any episode suggestions, be sure to share those too. Don't forget to leave a comment or send us any feedback. The Big Story publishes every day, and don't miss our weekend listens. I'm Maria Kestane. Thanks for listening.